The critical requirement for blood flow, oxygen, and nutrients to the stem cell niche is also why you hear a lot nowadays about the use of PRP, platelet-rich plasma, for trying to offset hair loss or even reverse hair loss. We're going to do an entire episode about PRP. It is pretty controversial in certain circles and well accepted in other circles. A couple of key things to understand about PRP. First of all, it is being used in multiple tissues for different purposes in different clinics. So for instance, board certified physicians in the United States, Canada, and Europe are doing PRP injections into ovaries to try and expand the number of healthy follicles and eggs so that people can conceive later in life or even earlier in life if they don't have many follicles. People are getting PRP injections into their joints in order to try and support joint health. People are getting PRP injections into just about every tissue you can think of. However, PRP, despite what you may have heard, is not stem cells. Somebody tells you they're injecting stem cells either outside the US, Canada, or Northern Europe, or they're injecting something else. So you want to really look into that. The safety issues there are the subject totally deserving of an entire episode. I'm not necessarily opposed to the future of stem cells as a treatment, but keep in mind that stem cells are cells that can give rise to lots of other cell types, and they are cells that divide and replicate. And there's a name for that when it happens in the adult body when you don't want that, and that's called cancer. Tumors are overproduction of cells from stem cells when those stem cells ordinarily should be quiescent. Okay, so keep in mind the difference between stem cells and PRP. PRP, platelet-rich plasma, again, is legal in the US and many other places because it involves drawing somebody's blood, spinning it down at a particular speed, which separates out different components within the blood, then taking the platelets and re-injecting those in a solution back into the person's body. So platelet-rich plasma, or PRP, is platelet-enriched plasma from that person. But the basis of PRP is really to encourage nutrient delivery to a particular region in the body using somebody's own platelets, because those platelets are enriched for various nutrients. So people are getting PRP injections into their scalp. Those are not stem cell injections. Those are PRP injections into the scalp with some moderate success. These are very expensive treatments. They tend to be transiently successful. I'm sure there are people out there who are going to say PRP worked fabulously well for me. That might be the case. I'm not going to dispute that, and I'm happy for you.